Hello, Professor Matteo. How are you?
Fine, thanks. Nice to meet you again.
Nice to meet you again. This is the second time I interview in the podcast, and I'm very happy to have you again for the podcast. Today we're on the IDS. And how many times have you been here?
Well, I'm proudly here for the 10th time. So
10th time?
Yes, it's
Nice.
really something that in my agenda is existing
Oh, nice.
just already for the next year.
Nice, nice. And what do you look for when you attend the IDS? Why do you attend, like I said?
Well, being a dentist, I believe that you can find here whatever is really up to date in the dental world.
I see.
Secondly, I really believe that this is every 2 years is the way, well, like university person, I meet many colleagues that I can see only here.
I see. And I also attended your lecture. You were giving a lecture earlier in the speaker's corner. And a subject that is also very relatable to Japan, which is geriatric dentistry and dealing with elder patients. Why did you become interested in this subject?
Well, their interest took me, I can say, because Italy as well, like Japan and several countries, one of the countries in the world where we have the oldest population. We are actually 2024, the last data, at 25%, more or less, of people of more than 65 years old. They already are in our clinics. They already ask for treatments.
Yeah.
But the interest being and leading a department for minimal invasive since many years, I was naturally involved on their problem because really you can realize they have different troubles, different requests, and different solutions.
I see. And like you mentioned, and being based with an understanding of minimal invasive dentistry comes along with this kinds of treatments that geriatric patients require. Again, in part of your lecture, you talked about like many dentists like to work with composites, but sometimes they are not the best materials to work with. So for you, like, how do you do your material selection in these kinds of cases?
Yeah, in truth, I like to say that patients and patients' mouth,
Yeah.
generally, while we are visiting them, they are telling us a lot of information.
Yeah.
The aim is visiting them and diagnosing for the first time is to read this information, to hear this information. Because really, when you have this kind of patient, you have several situations that you cannot find in children, that you cannot find in adults. And you can find similar cavities treated with the same materials, failing in the elderly population or quite quickly failing, and other with the same size or even more difficult in adults or in children, lasting for more time. So the interest came out because basically materials I decide every day to apply in patient mouth can really behave differently. And we start putting the interest inside the reason why this could work in more or less in the patient, and why the patient at the end could be happier with one treatment than the other.
And can you talk to us a little bit about the materials? What do you look for in a material, for example?
Well, if I have to tell you which is the best material in absolute concept, composite is, of course, the one giving us the best.
Yeah.
But if I have to use and to apply a material in a living patient with many needs, with many problems, with many troubles, and technical troubles even for me, for sure, 100%, I will never consider to have this material like the only one in my clinic. I need different weapons. And the properties I like is first some material that can be used in patients that cannot give us, for example, the same possibility of recall. Patients that are maybe living in some kind of structure like elderly, sometimes they do. Or people that can give us the perfect compliance. Sometimes they lose dexterity, for example. They can clean and brush their teeth perfectly for 60 years, and suddenly they cannot give us the same they were giving before. So material should deal with this kind of situation. So if I have a patient with low salivary flow, for example, and I know that composites can fail quite early, I would look for one material that is anyway able to self-defense, to protect himself from the biofilm, and the biofilm that is growing on the top of the surface, that in many cases, including composite, is the one making the failure. So if I could list the properties I would like to have in this kind of materials, especially for elderly, simple material, quick material, self-maintaining material, in many situations even a repairable materials, because sometimes you need to redo the restoration. This even happens for composite and other materials. But when happens, materials like glass ionomers or much better glass hybrids are repairable, quickly repairable. The patient should stay for a lower time on my chair, and I can anyway give the patient the same protection and being sure of the control of the biofilm. So I believe these are very important for me.
I see. I saw in one of your cases the patient, you used a very interesting thing when you chose a very light color.
Yeah.
To help the patient see the restorations. How do you see, is this applicable and also in other situations also? What is your opinion?
Yeah, this thing of the clear material is something that maybe on the photography is not very good to see, but for clinical action and protection of the patient, of course, this is really interesting, because we use it even in children, for example.
Right. Yeah.
If the patient can see the restoration, of course, we are not speaking about aesthetic area, but the patient is cooperating with you, because we show the restoration. If there is such a contrast, the patient can see the restoration, but this is not the aim of placing this color. The aim is that the patient, if can no longer see the restoration there, she realize, in that case the patient, she can realize if the material is still there, but still there means still protecting her, because that was a patient where the lesion occurred in less than 6 months. So I place that when I need cooperation. Of course, this allow me to get the patient in my treatment, really inside my treatment, to be aware and inside my treatment. Generally speaking, this kind of patient cannot see very well, elderly people. And so if they see the color, it is better for them. But cooperation is much more important, because if they have not that dexterity and they lose my protective restoration, I believe everything can restart.
I see. And the material, I think the one that you're using was Aquaforte, right?
Yes, right.
What do you like about this material in particular for these kinds of treatments?
My history with biomimetic and bioactive material is quite long. And I passed through the initial glass ionomer in the 90s, and I arrived at this. What I really like is that I saw the difference. I saw the difference in handling it, and I saw the difference in applying and in time. Over time, they can resist a lot. And really, I can use it in this situation, like cervical lesion or root caries, where before I was needing anyway a bioactive material or a glass ionomer material, but I was sure I needed to check it more and more, because they could detach. This material is stronger, is lasting, is easy to use. I can even say more aesthetic, so I can get properties.
It has different colors also? Right?
Yeah, from A1 to C4, I believe for dentists is enough.
Yeah, probably. Yes. And also, do you coat also the material?
Yeah.
So it's we can refresh the coats also like that. That's an interesting part of the material too, right?
Yeah. Science is telling us that the coating is really giving us the material we want. In other words, if we don't coat the material, we have a good material. If we coat the material, we have a permanent material. Transformation of the material inside, if we spend that kind of 20 seconds of our life, for the patient means a lot. In time, this comes not from the science, but from the experience. Every glass ionomers or glass hybrid, in time, due to brushing or mechanical forces, can lose some small particles, or some voids can form on the top. And what I really believe is that these voids can be filled by stains. And inside the voids, mechanical forces can bring some lateral forces that can break the material. If you coat, generally you keep a very luster surface. And in any case, patients should come back every 3 months, 4 months, 3 months, because you need to plan the recalls with this kind of patient. So 20 seconds after the professional to clinic is nothing.
It's nothing, right? Okay. Also, I saw many people taking a hands-on training by you.
Yeah, luckily.
Right now. Nice. So, is there anything that you realize that some dentists do not think of when they're doing all these treatments, or something that they don't take care of?
Yeah, I really believe that many dentists know glasionomers.
Yeah.
Many are maybe coming from the university time or from maybe even university training or attendance using glasionomer like Provisio now. Many of them already know the new technologies, but they want to know more.
Yeah.
If I had to make a classification of the things that I need to or I want to push every time I do this kind of course, is that the materials should be not over dried. Material loves water, should not be over dried with the air blow.
Yeah.
The coating gadgets should be put on a humid surface, because glasionomer is made of water.
Yeah.
And the coating gadgets should not be cleaned with air blow. Many are treating it like the adhesive for composite. But if I put the air blow on the coating, I lose a very important strength of the material. So there are some detailed tricks or tips about the material they need to be aware of. But from what I see generally, the ability of managing this kind of material that are really, really similar, like consistency to composite, it's easy for everybody. In the past, maybe they were a little bit more liquid and or sticky.
Yeah.
This is really important to touch, because they are like composite, but they gives us more and more properties. So
I see.
I have just to aware about the proper way to get the best
To get
out
the
of
best
them.
out. I see. And if we close with one more point, dentists who are working with geriatric patients, for example, what is your advice for them, or like a takeaway point when dealing with geriatric patients?
Well, it's I believe it's a very important attitude than a protocol.
Yeah.
That is considering that whatever I have to place in the mouth of the elderly people should deal with that environment. So very often, sometimes to have the MI concepts in the mind. So restorative is just a part, but even before, non-invasive treatment, application of varnishes, or products really able to block the progression or to stabilize the lesion is the real functioning things for the professional. So sometimes they should consider if the right protocol or the right program is not to do nothing, because sometimes keeping the lesion stable in time is the successful point, and keeping the lesion is to apply. It means apply MI concept, maybe varnishes, maybe gels, maybe even some ART techniques,
yeah.
But sometimes is not to do nothing and plan the right recall protocols. Because if we do that and keep the lesion stable, there is no longer the need for operative or invasive treatment that can create a problem.
Exactly.
So this is very important to understand.
Thank you very much, Professor. Appreciate
Always
you.
a pleasure.